Hello and welcome to the program today. I'm your host, Neal Howard. Thank you so much for joining us here at Health Professional Radio. Our guest in studio today is Dr. Alan Pitt, Chief Medical Officer of Avizia and attending physician and professor of neuroradiology at the Barrow Neurological Institute. He's here with us to discuss the 2016 National Telemedicine Survey report called Closing the Telehealth Gap. Welcome to Health Professional Radio this afternoon, Dr. Pitt.
Thank you very much. Appreciate being here.
Thank you. Thank you. The National Telemedicine Survey report, Closing the Telehealth Gap. First of all, what is your definition of telemedicine?
So telemedicine for me is a bit more is a bit of a broader term than is typically used. So when most people talk about telemedicine, they think about television, monitors, if you will, being connected over a distance. When I think about telemedicine, I think about it as to have the opportunity of bringing two people together over a distance. And the distance could be 8 miles or 8 floors within a hospital. The real question is, how do you bring those people together in a sustainable way that provides value in patient care? So you could bring two people together over secure texting. You could bring people together over the phone, or it could be a full video stream, as most people think about telemedicine. My passion, my belief is that what's really missing in healthcare today is the opportunity to provide reassurance for the patient, for their family member, and for the less skilled provider. Data is something that's very important, but really I'm looking for ways to bring those people together so that I can provide reassurance and avoid costly things like extra lab work, x-rays, transfers of patients. And so the technology is an enabler of that core mission, which is how do we provide reassurance within healthcare?
Well, let's talk about this gap within telemedicine, this survey that was conducted. Who was behind the survey?
So the survey was really of healthcare leaders across the country. We wanted to get a sense of where the market was, what people were thinking about in terms of telemedicine. And as you may know, telemedicine has been in evolution, really. The history of telemedicine, it started with NASA. It was an effort to try to provide healthcare for astronauts in space, and part of it came out of a story around Russian cosmonauts where Americans had picked up signals that Russian cosmonauts were actually supposed to draw blood on each other, and they kind of got into a little bit of a row in space, and NASA was very worried that if they couldn't provide health care to the astronauts, that missions would suffer. So they developed technology that would allow healthcare to be deployed in space. The next step in telemedicine was really to bring it back to the U.S., and it was deployed within rural America. How do we help people who don't have access to care at great distance? And so much of what happened in telemedicine initially was all around rural access. And that really has been something of a legacy. That's what most people think about when they think about telemedicine. Today, as we move forward in healthcare, we need to find better tools to bring hospital to bring hospital providers together, not only at a distance, but also within the hospital itself. You know, it can be just as much of a barrier to health if you live, 100 miles away, or if you have a bus ride and you can't see the doctor you need to see, or your child may be at school. Telemedicine is encompassing all of those things. It's a question of where does the market see itself today? So the survey was really about asking folks, where do you see telemedicine today?
Now, in the findings, did you identify maybe one key or the biggest barrier to effectively bringing people together? What was that one thing that we need to be focusing on going forward?
Well, there were a couple of things that I think are really worth pointing out. So first and foremost, I think telemedicine is evolving. And so many of the use cases that we're using telemedicine for are legacy use cases. And those are all growing, which is great, but there's a very large upside to telemedicine that needs to be explored. So the use cases that were highlighted were stroke, behavioral health, and staff education or training. Those are the top 3 use cases. And that was followed by primary care. Although great to have stroke out there as a lead, stroke is something that is a bit of an older model. We clearly can provide a lot of value, but there's so many other opportunities really to improve care through the continuum. The thing that I found perhaps most striking was that there are clearly changes in attitude by many hospital administrators. in terms of how they're looking at telehealth. So whereas in the not so distant past, people would talk about executive resistance to telehealth, and that was a very minor positive response. Only 4% of executives had resistance to telehealth today. The major things that seemed to be top of mind were issues related to investment in technology and infrastructure to support telehealth. And really the biggest struggle there is one around competing opportunities moving forward in the world of value-based care. Many healthcare systems are struggling to find the supporting structures to enable different forms of care delivery. And so I think telemedicine is really competing against a lot of parallel initiatives for data and meaningful use.
In the beginning of our conversation, we had a little bit of, an issue with the terms that are being used, the understanding, the thinking about telemedicine, telehealth. When we're talking, you use telemedicine, you use telehealth. Are the terms interchangeable, or is there a subtle or a glaring difference in the two terms as it relates to understanding and changing the conversation to provide better collaboration?
Well, I think the word medicine and health are terms that are evolving in the American lexicon, right? So traditionally, medicine has been about fixing the sick, whereas health has been about maintaining your health. And I think generally here in this country, we're moving towards more preventative wellness than treating the sick. That being said, the technologies, the use cases are very similar between telemedicine and telehealth. It's really, again, this opportunity to provide the right care at the right time so that the human touch, if you will, ironically it's a virtual touch, can be enabled to reduce the cost of care while improving outcomes.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard, and we've been in studio with Dr. Alan Pitt, Chief Medical Officer at Avizia and attending physician and professor of neuroradiology at the Barrow Neurological Institute, talking about the 2016 National Telemedicine Report called Closing the Telehealth Gap. It's been great having you here with us today, Doctor.
Thank you.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.